Hello, everyone. I want you to take note of how your back is feeling right now. Are you feeling a little bit of discomfort? Are you slouching in your chair? Or do you find that your back is just really stiff? If you said yes to any of these questions, you're not alone. In developed countries, the World Health Organization estimates that roughly 60 to 70% of adults will experience low back pain at some point in their life. In fact, it is the most commonly reported pain condition in the United States. So while low back pain is not the flashiest or the most interesting condition that you will hear about, it is such an important condition and it has a huge burden on our lives. So what exactly is it? Like the name implies, low back pain refers to any pain that is localized to the back portion. And there are four main types: acute, subacute, chronic, and radicular. And between these four types of low back pain, people in the United States spend more than $134 billion a year in pain management and treatment, which makes low back pain combined with neck pain the most expensive burden on our health system. So it would stand to reason that an ailment that has such a big impact on our health system and daily lives would have a clear set of treatment options. And sadly, this is not the case, and I've witnessed it firsthand. Both my mother and grandmother have been dealing with chronic low back pain for years, and their care hasn't been effective. Between the two of them, they've been to countless providers, even a spine surgeon, and they've had traction, physical therapy, and the list goes on. They've had so many appointments to the point where they feel like they're just a ping pong that's being sent back and forth between different medical providers. And over time, they've become disillusioned with the idea that their pain will go away or become solved. And this has become a common theme with millions of Americans. This summer, I had the opportunity to work with Dr. Christine Gertz to develop evidence-based clinical pathways for low back pain in the Duke University Health System. And I was grateful for the opportunity to work on something that has impacted people very close to my heart. Evidence-based clinical pathways and guidelines are rooted in peer-reviewed research, and they're constantly updated, which shows the continued medical commitment to care and accuracy. At Duke, there's also an increase to focus on non-operative and conservative care options, which can often cost less and increase patient outcomes. Here at the Duke Health System, we're constantly working to change how we see patients so that the experiences of people like my mother and grandmother can change. And under the umbrella of the newly formed Duke Spine Health Program, I had the opportunity to work on a variety of projects such as the clinical pathways this summer to improve the patient experience. And ultimately, the goal is to have a health system where patients can receive the most effective individual treatment from the best provider at the right time. So the next time that you find yourself with low back pain, know that you're not alone and that medical providers are constantly working to improve the care that you receive. Thank you.